It's a fascinating place because it has a very storied history. So when I was recruited from Johns Hopkins to help rebuild their abdominal transplant program. So my training was both in liver and pancreas, but also liver, kidney, and pancreas transplant. So from 1997 to 2006, I was the head of the transplant program here. And there was a tremendous amount of enthusiasm for rebuilding certain programs, which for one reason or another in sort of the 1970s and 80s had kind of decreased in volume a little bit. And I think at that time, in the late 1990s, Tulane had really focused on putting a lot of emphasis into some high-end surgical programs, everything from the surgical department to nursing to anesthesia to hospital. They were all really excited and enthusiastic. I think the challenge at the time was that the overall identity of what we wanted Tulane Medical Center to really be and how we wanted it to interact with the charity hospital system wasn't really clear. It was sort of a transition period, I think is the best way to phrase it. After 2005, when we again reevaluated everything after Hurricane Katrina, I think that's when the Tulane Medical Center really focused its attention on certain high-end, or what we call tertiary or quaternary services that we felt we could really deliver in a team approach. We could put the different service lines together so that they were collaborative and symbiotic as opposed to going in kind of sometimes different directions. It's sort of interesting because I'm a sailor and I do offshore racing. And so I'm pretty good at the weather. And remember, I was the head of the transplant program at the time, and I was pretty sure, I was definitely not in the mainstream, but I was pretty sure it was going to come to New Orleans or close. So actually, the Wednesday before, I actually closed the transplant program. And not everyone agreed with my decision. In retrospect, of course, it was a very good decision, but we actually closed it and we got all the transplant patients out of the hospital. And again, in retrospect, that was the right thing to do. So we got them all out of the hospital. It was an amazing feat to reconstitute, and my main focus initially was on the transplant program, to reconstitute it at the time. We used internet networking. We had patients and doctors and nurses across 3 states, from Alabama, Mississippi, and Louisiana, offering help and assistance. So there were a couple of us as the physicians. I literally lived out of suburban and drove all around Louisiana, Mississippi, seeing patients in different hospitals, different doctors' offices. At that time, we had a very large program of patients who were on clinical trials for immunosuppressive medications, and we actually arranged with Novartis Pharmaceuticals to fly a plane with $250,000 worth of medication into Baton Rouge. And it was very challenging because these patients were on clinical trials which have to be monitored, but of course our monitoring system, which we call the IRB, didn't exist. So we had to find additional ones and then distribute that medication with methods that met the requirements of the FDA and other people. So it was an exciting, challenging time. I was only out of New Orleans about 1 week. And then I came back very early and used this as sort of a home base. Our transplant offices at the time were on the 18th floor of a building which is owned by the medical school. And there were no lights, and we know we needed some of the patient charts. So actually a group of us, nurses and physicians, we got permission to go into the building, and we climbed up the stairwell many times, 18 floors, and carried down boxes of medical records. Again, violating certain rules for sure. We put them in the back of the Suburban, but it was the only way we could be sure we were providing the right care to these patients, to make sure we continued the proper medications if they were on a clinical trial. What arm of the clinical trial were they on? All these things were absolutely necessary. And the amazing thing is that the results of the transplant, the outcomes of the transplant patients at that time, did not diminish at all. In fact, we didn't lose any transplants. We didn't lose any patients because of medication complications. And it was because of the efforts of so many people. It was actually closed till Valentine's Day 2016 was when it first was the soft reopening. And the great part of the story from a transplant program was that the Tuesday after Hurricane Katrina, we had scheduled a living donor transplant between a husband and his wife. And so they waited, and they were displaced and everything too. And so that was the first transplant we did after the storm, after we reopened. And of course, with tying in with Valentine's Day and husband and wife, it was a great story. And I think that kidney's still doing super well.